Nigeria, Africa's most populated country, rich in natural resources, and yet home to some of the poorest people on the planet. A nation where health problems abound and where clean drinking water is scarce. We are the Tulsi Chanrai Foundation, or TCF, and our heart resides in Nigeria. TCF is a charitable trust established by the Chanrai family and like-minded donors. Its goal is to address some of Nigeria's most vital needs and through its projects bring hope to hundreds of thousands.
The partnership with Tulsi Chanrai Foundation has been very gratifying for the T.Y. Danjuma Foundation. As a matter of fact, the Tulsi Chanrai Foundation is one of our legacy grantees. We study the proposals they make and provide financial resources for them to carry out these projects for us. And they have been among the star grantees that we have had.
In Nigeria, TCF has implemented 3 projects: the Mission for Water project, the Mission for Primary Health project, and the Mission for Vision project. Since the project began, the TCF Mission for Water project has rehabilitated 3,887 hand pumps in partnership with UNICEF, the Federal Ministry of Water Resources, state governments, the T.Y. Danjuma Foundation, and other like-minded donor agencies. When the project started, it had one single goal: to ensure that people did not have to trek miles to gather water that was contaminated with waterborne diseases and thus unfit for human consumption. To achieve this mammoth task, they found a simple and cost-effective solution. TCF started with the understanding that the cost of reactivating a non-functioning borewell would be just a fifth of what it would cost to drill a brand new borehole. The next step was to identify from amongst the thousands of borewells and pumps sunk across the country those that could be made operable. They then rehabilitated these hand pumps in partnership with the local community. Once the community was mobilized, committees were formed at each hand pump. After this, local village workmen were trained to repair and maintain the hand pumps. This made certain that the community played an integral part in ensuring their own water security. Through its by the people, for the people concept of maintenance, TCF has been able to target a 75% functionality rate of hand pumps against the current national average of just 52%. With an average of 600 people benefiting from each rehabilitated hand pump, clean drinking water is changing the lives of communities.
Before the borehole came, we were drinking water from the stream. But after the borehole came, we realized that what we were drinking was not good enough for us.
TCF's ultimate goal is to set up similar water projects in each state so that every Nigerian can have access to clean and safe drinking water.
We would like to see this model replicated in many parts of the country because provision of safe drinking water, as we have said, is a fundamental for health care, preventive health care, and reduces the cost of treatment of unnecessary ailments.
The Mission for Primary Health project began by setting up pilot projects in Eniosa, Adana, Isu, Yola, and Kachia. Its goals provide essential frontline medical care, especially for mothers and children, in deprived rural areas. Reduce the distance that rural women have to travel to access basic health care. Ensure that all medicines that are given are genuine. Deliver free health care to pregnant women and infants till the age of 5. Bring this health care to the very doorstep of communities. These goals have been addressed through a very simple yet effective model. At the grassroots level are health posts. These are established in outlying areas for the surrounding population, serving about 2,500 people each. These health posts are grouped into clusters of 10, with each group overseen by one of the 3 or 4 health clinics. In turn, these health clinics are managed by the primary health center in a government building. This model has secured the health and well-being of over 1 million mothers and children since its inception. Encouraged by this success, TCF entered into a technical collaboration with the Cross River State Government to bring primary health care to the entire state. This project now covers a population of 3 million in 18 local government areas.
My first request was that they should partner with Cross River State, but not in one local government or in one community. I wanted Tulsi Chanrai to work with us in achieving or revisiting this vision across the state. Initially for TCF, it sounded like a tall order, but I assured them that I was committed and the political will was there to ensure that we give them the support and the partnership to reach as many cross-riverians in very rural communities who needed these services.
No parents always afraid of going to children's clinic, but the treatment was very free because they go to other hospitals. They spend a lot of money. But when I came, I discovered this place. After the treatment, doctor could not collect even 10 kobo from me.
TCF, along with the Keval Ram Foundation, has now set up another primary healthcare center in Zaria in Kaduna State. TCF would like to build such partnerships with all 36 of Nigeria's states. In 1999, the Tulsi Chanrai Foundation's Mission for Vision program commenced this mammoth task with a hospital in Birnin-Kebbi in Kebbi State, and then followed it up with similar programs in Calabar in Cross River State, Katsina in Katsina State, Owerri in Imo State, and Yola in Adamawa State. Their model is very simple. Identify the patients through outreach camps or at outpatient clinics at the hospital. Do a complete ophthalmological evaluation and then perform a relatively simple operation using the best doctors and equipment. When the bandages are removed, the patients are overjoyed to see a world they thought they would never see again.
I feel happy. More than before. I see your mouth. I see your teeth.
Mission for Vision first started in India, where the family follows the philosophy of caring capitalism. And the idea was to share the money one makes with the population in large. I saw my experience in India, where we set up 25 hospitals. The need in Nigeria for eye care is immense.
As with most of sub-Saharan Africa, the eye care needs in Nigeria also is enormous. It's not only for the basic eye care services like cataract or glasses, where there is some availability. When it comes to more advanced conditions of the retina or glaucoma or the cornea, the services are almost non-existent. The Chanrai Foundation already has quite a legendary track record in Nigeria of serving the community on multiple fronts. and most notably in eye care. It is in this broad context that Tulsi Chanrai Foundation and Aravind Eye Hospitals are coming together.
It is towards this continuing vision to bring sight back to those with curable blindness that the Tulsi Chanrai Foundation has set up a super specialty eye hospital in the country's capital, Abuja. The hospital will conduct an outreach program every week within a radius of 100 kilometers, screening about 300 persons, thus providing services to people who otherwise wouldn't have access to quality eye care. When fully functional, the hospital will be able to perform about 15,000 surgeries a year, of which at least 50% would be performed for free.
This is my friend that went for the operation. He said that they are very caring. They do the operation free for him. They didn't collect any money from him.
It is here, for the first time in Nigeria, that every patient who can afford to pay to have their sight restored would give the gift of sight to those who cannot. This hospital, which will have facilities, doctors and equipment that are comparable with the best in the world, will ensure that no Nigerian need go abroad when it comes to eye care.
When I go back, I'm going to tell people about this hospital. And they will have to know that there is a place in this country now that will take care of our eye problems. No need going abroad.
This is an endeavor that can cover all of Nigeria and bring an end to curable blindness. Through the success of the Mission for Vision project, the Mission for Primary Health project, and the Mission for Water project, TCF has proved that well-conceived, well-managed projects can irrevocably change lives.
I think that if we can replicate this model all around the country, we'll be better for it. Because it's basic, it's simple, and it addresses the real problem of the people.
However, the Foundation's goal of bringing sight, health and water to each and every Nigerian who needs it is far from complete. Millions await deliverance.
For TCF to be taken across the country, we need government support. We would like the federal government to adopt the 3 projects that we have started with in TCF, to try and scale it up throughout the country. My dream today is one day every Nigerian will have these facilities.